Okay, so let's quickly talk about GCS or the Glasgow Coma Scale. Now, the Glasgow Coma Scale is highly tested, but it's also very relevant in clinical practice when you're evaluating a patient with a traumatic brain injury. And the GCS score allows you to evaluate a patient's level of consciousness and the severity of a traumatic brain injury. Now, right off the bat, exams will typically ask you at what GCS level will you need to intubate a patient. And the number you want to remember is less than 8. If you get a less than 8, that means the patient has a severe TBI, has a decreased level of consciousness, and is unable to protect their airway. And so you want to intubate any patient with a GCS score of less than 8. So what is actually involved? What are the components of the GCS score? Well, there's three main components. There's eye movement, there is the patient's ability to generate voice or speech, and then there is a motor response from a patient. Now, each component gives you a different number of points. So if you get all the points in eye movement, you get a total of 4 points. For voice, it is a total of 5 points, and for motor response, you get a total of 6 points. That means that in a normal patient without any signs of a TBI will have a total of 15 points. This is normal. Now, when a patient rolls in, you want to evaluate each component individually. So let's go from left to right. So the first component we want to talk about is eye movement. Now, a patient that has absolutely no eye movement, is not opening their eyes to voice, is not opening their eyes to command, and is certainly not opening their eyes spontaneously, they automatically get just 1 point. 1 point is bad. That means they're doing nothing with their eyes, which means on the opposite end, you could get the maximum number of points if you are opening your eyes. If you're opening your eyes voluntarily without any um, external input. Now let's go down the line. So if +1 means that you're not opening your eyes at all, a +2 means that you are opening your eyes, but you're only opening it to pain. So things like sternal rub, um, pinching, those types of sensations will lead to a patient opening their eyes. Now, the next component to what's even better is if you are able to open your eyes to voice. So no painful stimuli, no physical stimuli, but the patient is opening to maybe the sound of their name or you just talking to them. And then obviously from +3 to +4, you get a +4 if you're able to open your eyes voluntarily. So that is eye movement. Again, you want to think about it as no eye movement, opening to pain, opening to voice, and then spontaneous. Perfect. Next, let's talk about voice. So obviously the worst score that you could get is a +1, and that means that you are not speaking at all. You're not making sounds, you're not making words, and you're certainly not speaking in clear, concise sentences. Well, this means that your maximum number of points in the voice category, which is a +5, means that you are speaking voluntarily. There is no external stimuli. You're speaking in complete sentences and people are able to understand you. So let's walk down the aisle. So if +1 means that you're not speaking at all, +2 means that you are making sounds. Often it's gibberish. Maybe you're saying ah, ooh, but you're not saying words, you're not saying sentences, you're only making sounds. So from +2 to +3, what's better than making sounds? Well, that's just saying words. Maybe you're saying hat or bat or cat, but you're not speaking in full sentences, but it's certainly better than just making sounds. So what's better than making words? Well, now you're speaking sentences, but it's confused. It's confused sentences. You're saying things that don't really pertain to the situation at hand, but you're speaking in complete sentences. And what's better than confused speech? Well, you're speaking clearly, concisely. People are able to understand you. So that's how you look at voice. Again, +1 means nothing. Next step is you're making sounds. Next, you're putting sounds together, you're making words. Next, you're putting words together and you're making sentences, though they're confused. And then lastly, you're speaking in complete sentences that make perfect sense. So that is the voice category. Now, lastly is motor response. Now, motor response is the most complex, so you get the most points out of it. Now, walking down the aisle, +1 means that you are doing nothing. You are not moving, you're not responding to any stimuli, you're just laying there. Which means that +6 means that you are moving everything spontaneously, voluntarily. You don't need any external factors. So again, let's walk down the aisle until we get to a grade score. So if +1 means no movement, +2 and +3 involves posturing. So there's something called decorticate positioning, where your arms are flexed towards your chest, and then there's decerebrate positioning, where your arms are extended away from your chest. What you want to remember is that decerebrate, or extending your arms away from your chest so that you look very stiff, is worse than decorticate. And the way I like to think about it is decorticate, where you are flexing your arms towards your chest, almost looks like you are protecting your heart, right? Core can be referenced to heart. So decorticate is better than decerebrate. In other words, decerebrate, where you are extending your arms, is worse than decorticate, where you are flexing your arms. So after that, you want to have a motor response to pain. And then you want a motor response to localization. What does this mean? So +4 means movement to pain. So if you do a sternal rub on a patient, they should be able to move. And then localization to pain means you are giving an external stimuli, or you're telling the patient to tell you where the pain is located, and they're able to pinpoint or locate where the pain is by pointing. So that is localization. And obviously after localization is the patient is moving everything on their own. So that is a quick and dirty way to look at GCS score. And what you want to remember, EVM. E for eye movement, V for voice, and M for motor response. Remember that from left to right, you go from +4 to +5 to +6, giving you a total of 15 points. And you want to remember that GCS less than or equal to 8, you want to intubate. And that is it.